Alzheimer's disease, a progressive brain disorder that affects memory, thinking, and behavior, often starts with subtle symptoms that can easily go unnoticed. One of the earliest and most noticeable signs is memory loss. While it's normal to occasionally forget where you left your keys, Alzheimer's-related memory loss is more persistent and disruptive. It often starts with forgetting recent events or conversations, repeatedly asking the same questions, or struggling to recall important dates. Difficulty planning or solving problems is another red flag. You might struggle with tasks that require focus and attention, such as managing finances, following a recipe, or keeping track of monthly bills. Simple processes that were once routine may now seem confusing or overwhelming. This cognitive decline can start subtly but becomes more pronounced as the disease progresses. Confusion with date or place is also common in the early stages of Alzheimer's. You might lose track of dates, seasons, or even the passage of time. Forgetting why you walked into a room is normal, but forgetting where you are or how you got there is a more concerning sign. This disorientation can sometimes lead to difficulty navigating familiar routes or remembering how to return home. Another key warning sign is the difficulty finding the right words or following conversations. Alzheimer's can affect language skills, making it hard to name objects, join discussions, or even understand what others are saying. You may find yourself stopping mid-sentence or repeating yourself, and over time, this may lead to withdrawing from social interactions out of frustration or embarrassment. Misplacing items and losing the ability to retrace steps is another subtle but telling sign. It's one thing to misplace your glasses occasionally, but repeatedly, putting objects in unusual places, like placing your wallet in the fridge, and being unable to locate them is a cause for concern. Over time, this behavior becomes more frequent and distressing. Decreased or poor judgment often appears early in Alzheimer's disease. This might manifest as making uncharacteristically poor financial decisions, neglecting personal hygiene, or being easily persuaded by scammers. These lapses in judgment often go unnoticed at first, but can escalate quickly. You might also notice changes in mood or personality. Early Alzheimer's can lead to increased anxiety, irritability, or depression. You might feel unusually suspicious, easily upset, or fearful, especially when in unfamiliar situations. Social withdrawal is another common behavior, as individuals may feel overwhelmed or embarrassed by their cognitive struggles. Difficulty with visual or spatial relationships can also be an early sign. You might find it harder to judge distances, perceive depth, or understand spatial relationships, which can make tasks like driving or parking challenging. This symptom is linked to changes in the brain's ability to process visual information and is often one of the first signs people notice. Lastly, there's often a decline in the ability to perform everyday tasks or hobbies. Things you once enjoyed, like cooking, gardening, or playing a musical instrument, might feel more difficult or less enjoyable. This subtle withdrawal from activities is often dismissed as aging or stress, but it can indicate early cognitive decline. If you or a loved one notice these symptoms, it's essential to consult a healthcare professional for a thorough evaluation. Early diagnosis can open the door to treatments and strategies that help manage symptoms and improve quality of life. Pay close attention to these signs. Your body may be trying to tell you something important about your brain health.